House lawmakers have given final approval to a state budget that relies on hundreds of millions of dollars in federal funding that might evaporate by summer. Plus, Vermont's top healthcare regulator says we're at a breaking point. And a report out from 7 Days says Vermont needs to confront a drinking problem. All that and more ahead on Vermont This Week.
From the Vermont Public Studio in Winooski, this is Vermont This Week. Made possible in part by the Lintelak Foundation and Milne Travel. Here's Moderator Mitch Wertlieb.
Thanks for joining us on Vermont This Week. I'm Mitch Wertlieb. It's Friday, April 4th. And joining us on the panel this week, Peter Hirschfeld from Vermont Public, Colin Flanders from 7 Days, and Mikaela Lefrak from Vermont Public. Thank you all so much for being here. Pete, I want to start with you. House lawmakers have approved a 2026 fiscal year budget. I suppose that's the good news, but there are some serious caveats with this budget, concern that lawmakers have expressed over what could happen come summer. What can you tell us about that?
So, as we speak, the Republican-controlled Congress in Washington, D.C. is looking at a budget proposal that aims to reduce federal spending by about $880 billion. And there are a lot of Democrats that say the only way you're going to get that level of reductions is by going to Medicaid. And so Vermont, of course, is heavily reliant on federal money generally, but Medicaid funding specifically. We've got about $2 billion worth of Medicaid funding in our budget. So the House of Representatives advanced a budget last week, $9 billion state budget, that relies on money that could be on the chopping block, right? And so they could find themselves toward the end of the legislative session, finding out that hundreds of millions of dollars in revenue that they had been counting on to fund this budget is gone. And it is going to pose some potentially existential questions about significant numbers of state programs if that comes to pass.
Couple of quick follow-ups there. When might lawmakers here know whether that money is going to be available or not? And if it's not, what do they do next? What do they turn to?
So people that I've spoken with in the federal delegation say Memorial Day is on or around when Republicans are hoping to hold that vote. It's entirely up to the GOP to decide when the timing is. As for what happens, you're looking at the potential for rethinking the wisdom of spending $100 million in state money to buy down next year's property tax rates. I talked to the chair of the Senate Appropriations Committee who said property tax relief might not look quite as big a priority if we're looking at kicking seniors out of assisted living facilities. We're also hearing some lawmakers, including Washington County Senator Ann Cummings, who's a Blue Dog Democrat, chair of the Finance Committee, saying if the harms are going to be severe, we might want to consider a Snelling-esque tax increase. And this was a time-limited state income tax increase that was done in the early 90s during a recessionary period where Republicans and Democrats came together and said the situation is bad enough that we need to raise state revenues. That's certainly going to be a conversation if we see the scope of federal cuts that Republicans are talking about now.
Okay, but what's Governor Phil Scott's take on that? I mean, he's never been crazy about, increased fees, increased taxes. Is he looking at this, though, and the reality of what you were just talking about and saying, well, this is maybe something we'd have to consider?
I put the question to him. If we see those federal cuts arrive in the form that they're being considered right now, would you be willing to consider raising state income taxes or revenues in order to address it? And he said, that's not a question I'm willing to answer right now. So Phil Scott didn't say no way, no how, as he has in the past when talking about the prospect of increasing state revenues. But he is very clearly wanting to put the focus on how do we reduce spending, where do we look to cut, before you put income tax increases on the table.
Okay. The federal situation is really complicating so many things at the state level. It's probably happening, well, it's definitely happening, not just in Vermont, but around the country. Colin, I know that you've been covering some issues with federal grants that Vermont needs for its health department. About $7 million here. They're losing that federal grant money?
Yeah, so just recently, the Trump administration rescinded these grants that were authorized through Congress during the height of the COVID pandemic as some of these COVID relief bills. And these were grants that were mainly used to build out our COVID response, especially vaccines, but have been continued to aid our efforts in responding to all sorts of things, infectious diseases, healthcare inequities. A lot of these organizations that are relying on these funds were expecting them to expire in the coming months, but I think the immediate closure of it took a lot of people by shock. The state says that this is going to impact their ability to not only provide flu vaccines, COVID vaccines, but also to do outreach meant to increase the vaccination rates. And as we know, that's really important now as we see these measles outbreaks across the country. And so it was a shock and a blow to, I think, the health in this state.
Well, not to pile on, but Mikaela Lefrak, you had a conversation recently on Vermont Edition with Owen Foster, the head of the Green Mountain Care Board. They regulate healthcare in the state of Vermont. Can you encapsulate for us what he said and his major concerns? And he was very concerned about the state's largest health insurer, Blue Cross Blue Shield.
Yeah, and I also just we've had a number of conversations on the show recently with some key players in the world of healthcare in Vermont, including Mike Fisher, the chief healthcare advocate for the state, Dr. Mark Levine, the head of the Department of Health, who just retired at the end of last month, and Owen Foster, who's the head of the Green Mountain Care Board. And for folks who don't know, the Green Mountain Care Board approves hospital budgets and insurance rate increases. So in just a couple weeks, Blue Cross, which is the state's largest insurer, they insure about a third of Vermonters, are going to submit basically their request for how much they can increase premiums in the next year. And both Owen Foster and Mike Fisher, the chief healthcare advocate, say it's going to be significant, probably around 15 or 20%. Now, the Green Mountain Care Board in previous years has pushed back on those rate requests from Blue Cross and only approved a lower version of what they asked for. And Blue Cross, which is now on the brink of financial insolvency, it has been pointing the finger at the care board saying, we are insolvent because you have not allowed us to raise rates in the way that we need to in order to cover people's claims.
But something has to give here because Vermonters already pay some of the highest insurance premiums in the country.
The highest, yes.
The highest,
yeah.
okay. Yeah. So again, these rate increases, it sounds like they're coming.
Yeah. So basically, it's I don't know what the right metaphor is here, but a three-part storm. So people are struggling. Our premiums are too high for many people to afford. Hospitals are struggling. And we saw this report come out in the fall that showed that many of our hospitals, I think about a third or so, maybe a little more of Vermont's 14 hospitals are on the brink of insolvency as well. And our major insurer, Blue Cross, is financially struggling as well. So Owen Foster says, without either major subsidies from commercial insurance or taxpayers, some hospitals are going to close. That's what's going to happen.
Colin, you've been covering this as well.
Yes, I think that hospitals are right now taking a hard look at their budgets. They're preparing their budgets for the upcoming cycle. I've been talking to some rural hospital CEOs this week who are saying that they think it's going to be very difficult to hit the benchmarks that the Care Board has set up. And the challenge there is that the higher hospital prices go, the more pressure there is on Blue Cross Blue Shield. I want to bring us back to the beginning of this, that the federal, what's going on at the federal government could have such an impact on this. It is hard to overstate what major cuts to Medicaid would do for especially these rural hospitals that have primarily low-income patient pools. I mean, it could be completely devastating. And I will say, I was on the show 6 months ago talking about that big report that came out. Mm-hmm. A lot of the hospitals pushed back on that and said it's kind of this doomsday scenario. 6 months later, it's looking like where they had it wrong was that they might be projecting too far into the future, that this might actually be coming sooner than we expected, and a lot of hospitals are struggling right now.
And can I also add, it's the Medicare cuts that are on the table right now at the federal level are a huge issue, but there's also major cuts that are being proposed to different healthcare subsidies, which could make health insurance more expensive, particularly for low-income people, and there's money on the table for these federally qualified healthcare centers.
Yeah, this is not just hospitals, right? We are talking about things like federally qualified healthcare centers that provide primary care and dental care to tens of thousands of low-income patients across Vermont. I've talked to officials in Montpelier who are convinced that if we see cuts from Washington like they're talking about right now, some of those FQHCs are going to go under.
Mikaela, again, just to stress how serious Owen Foster was saying this problem is, I don't think I'm telling any tales out of school here when I say that when you interviewed him, he actually started to tear up over this issue. Did he not?
Yeah, he did. He got very emotional and started crying at one point, which was, I think, a really honest reflection of the place that, I mean, he's under a lot of pressure. The board is, as is, the heads of these hospitals, the people who work there, people who are trying to afford health insurance right now. I mean, it's a pressure cooker, and it's, we're in a tough place. It's hard to put a silver lining on this one.
I mean, this is kind of an existential crisis. It's an existential question. If this largest insurer in Vermont, 1/3, you say, they cover people in Vermont, if it did go under, what would happen to the healthcare system in the state of Vermont?
According to Representative Alyssa Black, who's the chair of the House Healthcare Committee, the healthcare system would cease to exist as we know it. That's a direct quote from her. That is why they fashioned legislation in Montpelier that creates a sort of emergency financial relief trigger if Blue Cross's finances dip below a certain threshold. But the healthcare system in Vermont, it's a closed loop system. If you lose money from somewhere, it's got to come from somewhere else within that system. So you can't just say they're going to have to pay more, you're going to have to charge less. It's a system-wide problem that's going to require a system-wide solution. One
of the things we discussed, it might have been a week or 2 weeks ago, because we talk about healthcare a lot on this show, was that the University of Vermont Medical Center is one of the few hospitals that was not losing money this year. And actually, they were told by the Green Mountain Care Board that, there may be some penalties because of this. It's a little complicated why that is exactly, but one of the possible solutions was for UVMMC to give some money to Blue Cross Blue Shield. I think it was about somewhere in the range of $10 to $15 million. Please correct me if I'm wrong.
Yep.
What would that help at all, or would that just be a little bit of a nudge in the right direction?
I think it's the latter.
Yeah, that's a drop in the bucket. I mean,
Okay.
I think what the takeaway from that is that UVM's stance on this seems to be shifting a little bit, whereas they've been very defensive over the last few years when they've been pointed to as an example of exorbitant cost. They just came out recently and kind of apologized for their service cuts they announced that caused a big stir. And so I think there is a hope that maybe we are having a bit of a coming to the table moment where everyone is in agreement. We'll see how long that lasts and how the budget cycle plays out.
Okay, well, we're all obviously going to watch this very closely. It's scary, but we'll have to wait and see on some level. I do think that, as everyone here has pointed out, what's happening at the federal level is really starting to affect states around the country, especially Vermont. So there may be some pushback there, but we'll have to see. Colin, I want to stick with you because you had a feature story in 7 days that was quite remarkable, and basically it's saying that Vermont, the state of Vermont, has a drinking problem. And I'll just throw one statistic out there. You said 61% of Vermont adults drink, and that's compared to 52% of U.S. adults otherwise. What does that mean exactly when we say drink? A lot, too much? What are we talking about?
Yeah, so those are pulled from national surveys, which are essentially asking people how much, or have you had anything to drink in the last 30 days? And so on its face, I mean, that's not a really remarkable stat. I mean, sure, you might have a beer every now and then at dinner, but when you start to pull back the curtain on some of these things, you do start to realize that not only do more Vermonters drink, but more Vermonters drink in really worrisome ways. Binge drinking rates are higher than national averages here. And it's not just the college kids. I think a lot of people start to assume that, it's because we have a pretty healthy college community around here. It's not. It's every single age group up above 65 and older, which is where some of these problems really start to manifest, the health issues. And people here drink chronically more than the national average as well. And I think we are learning more and more now about even the risks of moderate drinking and the various ramifications that has. And so I hoped that we made the case that it is a time to start really taking a closer look at this problem and what to do about it. Another stat in your article, 435 alcohol-related deaths were reported in 2021. That's up 36% from 2017. So obviously we're seeing some problems just in the last few years. Yeah, and those are deaths that are everything from like very closely related to alcohol use, like alcoholic liver disease, to some of the things that we're learning more now about alcohol's relation to cancer and to heart disease. And so those are a bit squishy numbers. They're estimates, but I think the takeaway is that we are really starting to feel the impacts of alcohol more and more. And I will say that's based on 2021. The pandemic had a pretty serious impact on drinking as well. And we've seen that reflected in national surveys as people were stuck home with nothing to do. And so I would not be surprised at all to see those numbers continue to climb when we learn more about them.
I also found it remarkable when you pointed out that, some of this problem has been overshadowed a little bit by the opioid epidemic in Vermont, which is quite serious and very dramatic. But because a lot of attention was paid to that over the last few years, maybe that has overshadowed a little bit of this very serious problem, as you say, chronic. I'm curious about the reaction that came from your article. What did people in the community say about it?
Yeah, I really think it struck a nerve with a lot of people. I think not only people who have people in their lives that they recognize maybe have an unhealthy relationship with alcohol, but also people who are starting to take a closer look at their own relationship and maybe thinking about like a beer or two every night at dinner, maybe that isn't serving me as well. Or am I drinking in unhealthy ways, such as trying to cope with stress or anxiety? And we are learning more about this nationally. I mean, just in January, the US Surgeon General came out and said that alcoholic beverages should have cancer warnings on them. So I think this is kind of reflective of this national moment that we're having, where people are trying to rethink their relationship to alcohol. And we really saw that. We got a ton of letters to the editor. I had a lot of people call me about it. I think it really hit home with a lot of people. Okay, and that article, again, is in 7 days. You should check it out. I want to turn back to, again, some issues that are happening federally. We know now that President Trump's tariffs are kind of in full effect. These are affecting a lot of different countries, including some very friendly countries that we have been friendly with, including Canada. Here's what Governor Phil Scott and Senator Pete Welch had to say about these tariffs.
I'm not a big fan of tariffs. We obviously have a right to defend ourselves in some respects in a trade situation, trade war, but we started this one.
A confident country treats its allies with respect. And these tariffs are going to do direct and immediate economic harm to everyday Vermont families and farmers, maple sugar producers.
Peter Hirschfeld, is this coming out to play? What are you hearing about from the business community in Vermont over these tariffs?
I talked to a guy who has a timber business in southern Vermont who said he saw his access to the Chinese market shut down last month. He believes as sort of a preemptive strike from China in anticipation of these tariffs, but he was able to find a buyer in Vietnam, so felt really fortunate. But Vietnam was near the top of the list for these new tariffs, 46% tariffs that are being imposed on imports from Vietnam. And this person is rightly worried, I think, that we're going to see a retaliatory strike that takes away this other option that he's found. Vermont has $1.9 billion a year in foreign exports. It's a huge part of our economy. Some of the countries targeted with tariffs might not sound like a big deal, but Trinidad and Tobago, for example, I think is Vermont's 6th largest trading partner. So economic officials in this state are worried that this is going to severely shrink access to global markets that we rely on, and in the short term at least could put some real stress on the broader economy here.
And we heard Peter Welch talking about maple sugar producers. Is it true that a lot of the equipment that a lot of Vermont maple sugar makers use comes from Canada, and that would affect them?
Yes, and it's business owners find themselves in these bizarre situations where they're ordering pieces of equipment that have different types of material sourced from different countries that are now going to be subject to different tariffs. And so untangling the web of charges that are involved has become a bureaucracy in and of itself for a lot of Vermont companies, and not something that they're happy to have added on to the already difficult day-to-day of running a business on small margins.
And Canada also, I know we're very protective of our Vermont maple syrup here, but we also import a lot of their syrup and package it into blends with Vermont maple syrup, and so those prices are going up as well.
That's a really good point. And Vermont produces the most maple syrup in America, but North America, that's our friends in Quebec. So they do a lot of that. Pete, I want to ask you about another story that Vermont sometimes gets into the national conversation on things. There was a woman who was taken from Massachusetts, I believe, by ICE officials detained in Vermont before being sent to Louisiana. Why was she in Vermont at all? What happened there?
So it sounds like this was the ICE process. They 6 plainclothes masked federal agents, as you said, detained this person in Massachusetts and then went to a ICE detention facility in St. Albans, Vermont, which is why it made headlines here, before getting on a flight out of Burlington to Louisiana. But obviously something that a lot of people in Vermont found unnerving, including Governor Phil Scott, who was asked about this at his weekly press briefing this week. And he said this action by ICE is something that we should be, quote, ashamed of. He feels like it's stretching the limits of law, and said he finds it to be a really concerning development in the Trump administration's mass deportation plan.
Yeah, we're gonna talk about that more, but one gets the feeling that Governor Scott is getting a little tired of having to answer a lot of these questions dealing with federal things from the Trump administration. You can sort of see it. He's weary of it in talking about it.
Yeah, well, there's a version of Phil Scott that we saw in 2016 and 2020 and in the run-up to the last presidential election, where he didn't hold back when he was talking about President Trump. I mean, he's described his presidency in the most severe terms, condemned it. He called on Trump to either step down or be impeached after January 6th. We've not seen that level of rhetoric from the governor since Trump was inaugurated for his second term. I think we are beginning to see an evolution in his rhetoric that may be leading to a place where we see a reboot.
Okay, and briefly I want to stick with you on this, Pete. The governor is, however, getting some criticism locally for what has happened with the Motel voucher program. Some unhoused people have been, they are now in that 80-day limit. Not for everyone, though. I mean, there are some exceptions here, but what does the governor face criticism over with ending some of that Motel voucher program for some
So
people?
he's receiving criticism on 2 fronts. The executive order that Phil Scott signed protects some classes of people in that program, but not others. Others that the legislature wanted to protect, including, for instance, people fleeing domestic violence situations, people over 65. The governor's order is limited to only certain very vulnerable populations. So there's criticism about that, but we also saw the legislature's top lawyer say this week that she believes the executive order is unconstitutional, that it is a power grab from the executive that belongs with the legislature. It doesn't sound like the legislature is keen on bringing that to court right now, but certainly that's another element of this dynamic. The legislature is working on an alternative budget adjustment proposal that they hope can resolve all of this, but definitely no clear path ahead right now.
Okay, thank you for the update on that. Mikaela, Lefrak, I want to come back to you about something that's a little more fun to talk about in some ways. This is the annual spring migration season for
how much time we got,
our amphibian friends. I think we got about 3 minutes here.
Okay.
We're not going to take all of it at a time, but tell us what you've learned about this spring migration. Frogs, salamanders, they need safe passage across the roads.
Okay, and Colin, jump in here because I know
Please
we both care a lot about this story. It was like
It's
the
a great
relief that we
story.
needed from everything else we were reporting on. But yeah, so frogs and salamanders are on the move right now. It is their spring migration. They're going from their overwintering grounds to their breeding grounds, which are often like vernal pools and marshy areas. So there's when the conditions are right, so that's warm temperatures, wet earth, maybe after a rain, there's mass migrations of all these different species. So it could be spotted salamanders who have these bright yellow spots, wood frogs, spring peepers that make that little peeping sounds that we all know so well. And there are some places that are even closing down their roads to make sure that they can get across safely without getting smushed.
Yeah, I'm glad we brought this up because there was this delightful story in the Shelburne News this week about an event they're planning, and it contains probably the best quote I've seen all year in Vermont media from Kate Kelly, the herpetologist from Heinsberg, which say that 5 times fast, describing this species. You can see if you go to one of these, spotted salamander were brought up, and she described it as the sexy megafauna of the salamander world, which as someone who's always been a little afraid of lizards, I was skeptical, probably because I've seen Matilda too many times, but I have to say I Googled it, and it is really, really cool. So I'm going to have to keep an eye out this.
And sexy megafauna fauna, by the way, is going to be the name of my new punk band that I will never get to front. Just so you all know, come out and see us sometime. People will actually, though, as Colin was saying, there's events over this. People will stop by the sides of the road and check this out with flashlights. But it's also serious. People are being warned to look out for these little folks. These little amphibians.
Yeah,
don't run over them.
Yes.
It's that time of year.
And yeah, these are called big nights. There's also a lot of folks, herpetologists, who are asking people to report data about how many of these critters that they see. There's the Vermont Reptile and Amphibian Atlas that's collecting information because a lot of these are, they're not endangered, but they're, protected species, and we're trying to protect their wetlands and habitats here.
Let them do their thing. It's their time of year. I want to end on this. We've been talking a lot about the federal pressures that are happening and a lot of things coming out of the Trump administration. Colin, you've been writing about a Burlington woman who is embarking on a Canadian apology tour. What is she doing?
Yeah, that's right. So Karen Chickering, she's a 69-year-old from Burlington, and I think she had been feeling what a lot of people have been feeling about the way that President Trump has been handling Canada. She was unsettled, she was upset, and she wanted to kind of put that into motion. So she drove up to Sutton, Quebec a couple weeks ago, and she went into stores. She bought some chocolate or bought a little thing, and then went up to the counter and gave them a poster that she had made that had Vermont Loves Canada in a heart and Friends by Choice on the poster, and she asked to hang it up. And she wanted to say she's sorry for what's going on, and I think it resonated with a lot of people. Sorry, yeah.
Sorry, yes, and the politeness, and we hope to maintain our wonderful relationship with our friends to the north. Thank you so much for that update, and that's all we have time for today. Thank you so much to our great panel, Peter Hirschfeld from Vermont Public, Colin Flanders from 7 Days, and Mikaela Lefrak from Vermont Public. I'm Mitch Wertlieb. Thank you so much for watching and listening. I hope you'll tune in next week as well for Vermont This Week.